If you're a parent of a young child, hearing the letters RSV inflicts a certain fear into your heart. It can mean a hospital stay for your little one. Short for respiratory syncytial virus, RSV causes inflammation of the bronchioles, or the small airways in the lungs, resulting in an infection called bronchiolitis. As Parkview pediatrician Dr. Tony Giaquinta explains, bronchiolitis is more serious in children 2 and under, as it can inflame their small developing lungs, creating more mucus and making it harder to breathe.
You're going to notice extra muscle use. So sometimes they'll use their rib muscles, sometimes their belly muscles, sometimes their neck muscles, and even their nose muscles to help get as much oxygen into their lungs as possible.
Although bronchiolitis is one of the most common diagnoses and reasons to be admitted to the hospital for a child, a useful medicine has yet to be found.
And that breaks our heart as pediatricians. We want to give medicine to your baby to help them feel better. But we've tried different medicines like albuterol and steroids and antibiotics, and almost always these medicines don't really show to be very effective in helping to treat your baby's illness.
So what can we do to make our child feel better?
The most important thing to remember is that in the vast majority cases of bronchiolitis, your child will do fine with just a little bit of time and focusing on supportive care. What do I mean by that? I mean focusing on hydration, suctioning out their nose as much as you can, and making sure that they're not showing signs of severe respiratory distress. And that's where your pediatrician comes in.
Unfortunately, RSV is just one of the many viruses that can cause bronchiolitis. Other viral culprits include the common cold or the flu. As we head into the colder months, Dr. Giaquinta has an important reminder for everyone.
RSV is incredibly contagious. It passes like wildfire, especially in these winter months, but it is also completely preventable by washing hands. It is not spread in the air, it is not spread by coughing, it is spread by the human touch.
As the infection will hit its peak in about 3 days, some symptoms linger or even come back. This can be frustrating.
When parents ask me what is the best thing to help this get better, I say time. Time will heal your child's lungs. But until then, we might have to try some extra things like IV fluids and sometimes aggressive suctioning or occasionally oxygen. But overall, I want you to know that just with a little bit of time and tender loving care, your child will beat this infection.
This has been Making the Rounds, brought to you by Parkview Health.